What happens when you die? When a person dies, their body undergoes a series of physical changes. Oxygen levels in the body decrease, which can slow circulation and cause the skin to turn mottled and the extremities to become cold. The person may also experience difficulty breathing and make noisy breathing sounds, a condition known as the death rattle, although it is not thought to be painful. When the heartbeat, breathing, and circulation stop, clinical death occurs, followed by biological death a few minutes later when brain cells die due to the lack of oxygen. It can be difficult to know exactly what death feels like, as people who are seriously ill or unconscious at the time of death are unable to describe their experiences. However, some people who have had near-death experiences and were later resuscitated have reported certain sensations. These experiences can vary greatly and are highly personal. In fact, research published in Frontiers in Neurology in 2020 suggests that between 8% and 10% of people have had a near-death experience at some point in their lives. Ultimately, death is a personal event and people may experience different sensations or none at all. Here are the 10 things you may feel when you die, based on real accounts. 1. You lose your senses. Palliative care specialist James Howlenbeck, who spoke with The Atlantic in 2016, explained that a process called active dying often occurs during the final days of people who are dying gradually. During this time, the senses tend to shut down in a specific order. Hunger and thirst disappear first, followed by the ability to speak and see. Hearing and touch usually persist a bit longer, but they eventually fade as well. A study published in Scientific Reports in 2020 found that hearing is often the last sense to go before death. 2. You might feel like you're dreaming. A thread on Ask Reddit invited people who had been clinically dead to describe their experiences, and some said that it felt like drifting into a dreamlike state. A study published in the Journal of Palliative Medicine in 2014 analyzed the dreams of hospice patients who were near death and found that about 88% of them reported having extremely vivid dreams that sometimes continued into their waking hours. Many of these dreams and visions featured deceased loved ones and were often comforting rather than frightening. This phenomenon is known as end-of-life dreams and visions. 3. You might experience a lot of thoughts and feelings. According to research published in PNAS in 2013, the brain becomes more active rather than less active as people approach death. This increase in brain activity may explain common elements of near-death experiences, such as the perception of past memories, a bright light, or the feeling of one's consciousness leaving the body. Lead study author Gma Borjajan, Ph.D., told the BBC, many people believed that the brain after clinical death was inactive or had less activity than the waking state, but our research shows this is definitely not the case. In fact, the brain is much more active during the dying process than it is in the waking state. 4. Your life may not flash before your eyes. People may expect their life to flash before their eyes as they die, but research published in Frontiers in Psychology in 2020 suggests that this may not be the case. The study found that the memories people experienced during near-death experiences were not flashbulb memories or brief snapshots of moments from the past. Instead, people who had come close to death reported seeing memories with a great deal of detail and information, much more than they could recall while awake in a laboratory setting. These memories may be more like a rich, multi-layered movie of a person's life rather than brief flashes. 5. You might still be aware of what's going on around you. According to research published in the Resuscitation Journal in 2014, people who were officially dead during a study were able to perceive awareness, meaning their brains were still functioning. Some were even able to hear conversations and see events occurring around them, which were later confirmed by people who were present and conscious at the time. 6. It might be painful. If a person dies due to a physical injury or allergic reaction, they may experience pain. San Francisco writer and activist Chris Gutierrez, who died of pancreatic cancer on August 4, 2013, wrote about the physical pain and mental frustration that she experienced as a result of her illness. However, she expressed a desire to die with as little pain as possible, surrounded by loved ones, and to help them find peace in the time remaining. She also requested that people spread awareness about the BCRA gene in order to potentially save lives. 7. You might feel surprisingly okay. In 1957, herpetologist Carl Patterson Schmidt was bitten by a poisonous snake and died about a day later. He kept a diary of his symptoms over the course of the day, which included chills and shaking, bleeding from the mouth and bowels, and general feelings of discomfort. Despite these symptoms, he apparently felt well enough to call the museum where he worked and tell them he would return the next day. However, his condition quickly worsened and he died soon after.
If you're imaginative, it might be an intense experience.
It is difficult to know exactly what happens when a person dies and how it differs from other people's experiences. However, research on near-death experiences can provide insights into how a person's personality may shape their death. A study published in Frontiers in Psychiatry in 2018 found that people with a tendency towards fantasy proneness, or those who spend a lot of time imagining stories in their heads, tended to report more intense near-death experiences than those with less active imaginations. The researchers used the Grayson NDE near-death experience scale, developed by NDE researcher Bruce Grayson, to measure people's responses to their close brushes with death. They suggested that imaginative individuals may be more attuned to their internal states as they die and may notice emotional shifts that others may not.
9. You might get dizzy.
In 2012, footballer or soccer player for Americans Fabrice Muamba suffered a heart attack in the middle of a game, was clinically dead for a time, and was successfully resuscitated. In an interview with The Guardian 2 years later, he spoke of what he could remember, which wasn't much. He felt dizzy, which is a common experience for people who have heart attacks, per Penn Medicine, and he thinks he had double vision, but that's all he knows.
10. You might feel nothing at all.
After Muamba experienced the dizziness and double vision, he said he just felt nothing. It wasn't positive, really, but it wasn't painful or negative either. There are many questions about that active dying those who are dying gradually experience. Without your senses, what do you really feel?
Thank you for watching. For more fascinating facts, please like and subscribe.